Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Wednesday, May 11th, and I'm here today with Ed Brubaker, Living Branches President and CEO. Welcome.
Good afternoon, Alex.
Felt a little strange to say Wednesday.
Yeah, that's right. You're used to saying Friday.
Or at least Monday. We've been doing that too. Well, we're here. Unfortunately, we get to talk about COVID again today. I was thinking that maybe we would avoid that. But we absolutely are experiencing some cases on our campus. So from a count perspective, right now there are 2 residents in Dock Acres at Dock Woods who are testing positive and 3 staff persons at Dock Woods who are testing positive. At Souderton, right now, we have 8 persons in the residential living apartments who are positive, 1 person in a cottage, 1 person in a villa, and then 2 staff persons. No one at Willows. So we are seeing a bit of resurgence, and that seems to match what's going on in our local community, as we've talked about many times before.
Yeah, that's right. And that's really, we mirror what happens out there. It's interesting, though, that we, right now, and this could change tomorrow, but it appears that we have more residential living, and specifically at Souderton, than we do amongst staff. So that has not typically been the case in the past, but it's the ongoing reality of the disease as our residents are out and about more. Maybe our staff have immunity because of having COVID or because of the vaccine. It's so many different variables. But yes, right now, the fortunate thing is, though, that the situation is that most cases are still rather light symptoms. However, with that said, we have had some staff, or I shouldn't say some staff, at least I know of 1 staff member who had some more heavy symptoms with this. And so it's continuing to be variable, but it does seem like it's creeping up a bit.
It might be worth it to mention to people I've lost track of the number of people who tested positive who said, oh, I thought it was just a cold. Or I thought it was just allergies, because the symptoms really seem to mimic that. Right,
and the allergy thing has been a recent one, and that would make sense too, because it's allergy season, and so you're out and about, and so allergies are happening, and you can pass it off as that, and it's not always that case.
Yeah, so if you're a resident and you have the sniffles, don't hesitate to contact your residential living nurse to arrange for testing. Better safe than sorry, I think, at this point.
Yeah, that's right.
Well, and especially because you were just mentioning earlier that there is a local hospital that is seeing an increase in hospitalizations again.
Yeah, again, the numbers are still low compared to what they have been in the past, but I think Grandview had 0 patients, I was being told a few weeks ago, in COVID positive patients, and as of yesterday had 6. And so that is not a huge number compared to what it has been in the past. It's gone into the 30s, into the 40s, but it is more than they had recently. And so that's another number that's really important for us to watch, and that is COVID hospital admissions and also ICU admissions for COVID.
When I've been on campus in the last couple of days, I've had a couple of residential living residents ask me, I feel like they're waiting for the other shoe to drop. So they're seeing these case counts going back up again, and they're wondering, when are we going to be tightening restrictions?
Yeah, and that's an interesting question. I can certainly understand the concern of that because that would mirror what was done in the past. There's been some things that have been changing in that regard, and specifically related to the positivity rate. The number of tests, particularly negative tests, that are now being reported to governmental agencies for looking at positivity rates, we don't have to report our negative tests anymore. And so if you know anything about mathematics, if the denominator goes down, but the numerator stays the same, the percentage goes up. And so that is impacting us right now. The reality, though, is the mix of the positivity rate plus the rate per 100,000 still dictates what we need to do in healthcare. And so our testing protocols for staff, et cetera, And the combination of that positivity rate and the rate per 100,000 determines whether we're in high transmission, substantial transmission, the different layers we have, and then those correspond to how often we need to test. I'm hoping that at some point the state and feds will change that review structure, because it's not making quite as much sense as it used to. But the reality is that's what we have. And the other reality is case counts are creeping up, but the positivity rate is maybe a more variable rate anymore as far as review of it. But that's how we're still looking at testing. With that said, as we think about residential living, there's another kind of website that's out there at CMS that looks at community transmission. And so everybody other than healthcare looks at that to determine, are you in low or substantial or high? And that looks at a lot of different factors, one of them being hospital admissions, ICU admissions, et cetera. And so that is probably the criteria we will look more closely at when we think about residential. Because if the symptoms remain relatively light, there's no reason to go into, from my perspective, into the full-out lockdown mode anymore. But if the ICU admissions and the hospital admissions seem to be going up, which would tend to indicate the seriousness is going up again, that's something to pay attention to. Right now, fortunately, in Montgomery County, Pennsylvania, that's not happening right now, but it is something we will look at. So, to summarize all of that, we're looking at statistics a little bit differently now, partly because the severity of the illness, at least at this point, seems to be less. But frankly, no one knows where we're going and where it will be in the future. So we take it day by day, week by week. But fortunately, that's where we're at the moment.
And maybe just for clarity, I thought I heard you say that for residential living, the data that we were looking at was on the CMS website. And I think that should be the CDC website.
Yeah, I'm sorry. You are correct. It is CDC is the website for that. That's correct.
You can tell marketing people did not come up with the names for those websites because it's too confusing, too close together.
Well, I think the name of the actual web page is very similar too. So it does get a little confusing at times. But yeah, it would be the CDC website.
Well, let's maybe talk about something maybe a little bit more fun than COVID. Let's talk about construction, because especially at Dock Woods, we are getting close to actually seeing shovels in the ground or that type of a thing.
Yes, we are moving forward, and our targeted date is Monday, June 13, to actually start at the Dock Woods campus. That's when they hope to be moving in, and there may even be work before that with some tree removal and some other work that's being done. But we have some things that we need to make sure the paperwork is all, T's crossed, I's dotted, all those kind of things. So we're working at that these next couple weeks to make sure that everything's in as needed with the township. But we do anticipate that will be the date that we start there. We are not planning to have any kind of major groundbreaking there. It's going to be more of a low-key, perhaps ice cream event on that campus, just to kind of mark the day, or the week before we'll probably do it. But that's when we're looking at starting. Later this month, since Souderton is starting later in the year, that's when we'll have some meetings with Souderton residents to review what's happening at that campus. So that'll be later in May. We anticipate Souderton starting later in the year. We don't have exact dates for that because we still need to get our approvals from the township. We're hoping late summer or fall, but that's yet to be determined as far as a starting date. So yeah, things are happening, and exciting to anticipate this coming together.
It might be worth it just for us to talk briefly about the fact that because we are now getting ready to start construction at Dock Woods very, very soon, we're in the stage of planning where we are reducing the number of available beds at Dock Terrace. And this impacts all of our residents from the perspective of if people are needing short-term rehab, we do not have beds available right now.
Yeah, that's right. And we at the Dock Woods campus need to go from a census, or a possible census, of 72 down to 54. Now, the reality is we haven't been running at 72, so it's not like we're going from 72 to 54. It's more like it was maybe 68 or 66. But that still takes effort to do that, and we needed to stop bringing in people from the wider community, et cetera, and working at those things. So those plans are already in motion. We have had some people that were amenable to moving to Souderton or back to Souderton in some cases, and so we needed to work at that. We do anticipate that over time during construction, we'll kind of settle into a new normal with the new bed count, because actually as we studied what the bed count was that we needed per campus, it was not at 71 and 72. It was actually, I think, 45 to 47. So the point is we will still have technically what it would appear to be more beds that on average we need, even at the lower bed count, to care for our residents. But to get to that point, it will make a difference. And so we really appreciate the work that staff's been doing on this to get to that point, but also the residents and families and their understanding, because regardless of whether you know it's going to be a good outcome, it's still a stressor to move and to change venues and to change your home. And so we do recognize that, but we're also so very excited about the opportunities that this construction will bring to us and really improve the life on the campuses.
I am in meetings where we talk about this process and how we're doing this. And I also, of course, from a marketing role, have something to do with admissions into healthcare. And so far, I don't believe that there's anyone who is a resident anywhere at Living Branches in the continuing care retirement community or life plan community that's needed short-term rehab that we've had to ask go to another organization, but it has been touch and go, like down to the day. So I think part of it for me is just I want people to be aware that this is a possibility in the immediate future, just because it never feels good to have to do that.
Yeah, that's right. And we'll want to be trying to work with organizations that are like-minded to us in terms of care and philosophies of care and that kind of thing, and we're hoping to keep that to a minimum, but we can't promise that it won't happen, because as we work at these details, it may need to happen from time to time. Persons on the Souderton campus will remember from years ago that happened quite regularly before we added the additional 10 beds there, and so that was more of the experience at Souderton, although it's happened at Dock Woods as well. And so, again, like you said, we'll try to keep it to a minimum, but we do appreciate people's understanding as we're going through this process to get to where we want to be.
Yeah. And it's going to be so great to be there.
Yep.
Any final thoughts for us today?
Well, yeah, I was thinking about this too, and related to construction. There was an announcement. We didn't make a formal organizational announcement yet, and I'm not sure if you put it in branching out because of the deadlines for putting things in branching out. But we did get a $2 million RACP grant for Souderton Mennonite homes, and RACP is essentially capital improvement monies. Clemens Food Group had gotten some monies from there, Peter Becker, Elm Terrace, just naming some local facilities that have in the last year and a half gotten funding from that. We applied about a year ago. We didn't get any allocation from the December allocation last December, and so I was thinking, well, we maybe were just passed over, but a few weeks ago, Representative Steve Malagary called me late on a Friday night and Friday afternoon and said, hey, good news, can you call me back? And I thought maybe this was what it's about, but he let me know that we did get this grant, which is wonderful. There's paperwork, as you might imagine with governmental funding, that we'll need to go through, and there are things, T's we need to cross and I's dotted. But it is a really nice opportunity for us. I won't go into all the details, but they're really, because of how the funding mechanisms are set up, we did not apply at Dock Woods because that region did not have availability, whereas where Souderton is, they had availability for these grants. Again, won't go into all the details there because it may make it even more confusing. But the point is just to clarify why we got it at Souderton and we didn't apply at Dock Woods. And it was because it was not available. But we're really appreciative to Representative Malagary and also to Senator Maria Collette, who would have advocated for us as well. And so we're very pleased that we were able to get that. It helps pay for some of the project and also allows us to accommodate some of the increased costs that were unanticipated too along the way. So we're very pleased with that, very appreciative for that. And some very good news that we just got in the last few weeks. That's
exciting. Mm-hmm. It's nice to feel like local government is working for you.
Yeah, that's right. And Representative Malagary, he really, I appreciate his work, and he is very focused on the local community. And I don't want to get into which party and all those kind of things because that tends to be a little silly sometimes in politics. Because at the end of the day, politicians are our representatives to work on our behalf. And from my perspective, he does a very nice job with that.
So good. Thank you.
Thank you.
Thank you to you for watching. If you have questions for a future episode, please feel free to send them to coronavirusquestions@livingbranches.org. I suppose I should say your questions don't necessarily have to do with coronavirus anymore, but you're welcome to send them in, and we'll see you at a future date. Thank you.